Good morning, everyone. Why don't we get started? I'm going to give just a very brief recap of yesterday, especially for people that may not have been here yesterday and some of the people on the webcast. I thought we had a tremendous session yesterday and certainly tremendous discussion. And we really started out in a lesson of molecular biology yesterday morning and heard a lot of different things about the nervous system and how it detects fullness and taste receptors in the guts that can detect food components throughout the GI tract, and a whole series of hormones and peptides that are released to help signal the end of a meal. We then had a couple very nice talks that focused on imaging technologies and that showed that food and food components can change behavior of the brain and biochemistry of the brain. But at the end of this day, they really weren't able to predict addiction and are still, I think, in the development stage, but show a lot of promise in helping us understand food behavior. And then we heard a little bit about psychology and how psychology can override biology. So even though there's a pretty intricate system to help you determine how much to eat, there's many other factors that will often override that. And I know for myself, eating when you're already full is not an uncommon problem. So really overall, in this, I think in these sessions, that they're really, it was discussed and determined that there's really no biomarkers for things like food addiction. And I guess this is really probably not that surprising, because if we look at more classical addictions, we also don't see biomarkers for those as well. We then had a good discussion on sugar and fat and combinations of the two, on eating behavior and how they could impact eating behavior in unique ways. There was some good discussion from the audience about how it's, these food components and their combinations have been around for a long time, and it's really unclear why and how they could have changed since the beginning of the obesity crisis. And there was some discussion on ultra-processed foods and that this could be part of the problem. And there was a mention of a Fruit Loop Pop-Tart sort of a product, but I remember those from my childhood, and I thought, well, I wonder when they actually started, and both those products are from the early 60s. So they've been around for quite a long time before the obesity crisis. And something we kind of flirted with but didn't really talk that much about was food accessibility. And I think one of the things that is true these days, and since the start of the obesity crisis, is food is cheaper than it's ever been in our history. And it's certainly everywhere we go. And I'm not really sure how important it is to have Swedish meatballs in our furniture stores. So it's really, I think this may be a big component of how things have changed and maybe have changed eating behaviors. And then we had some very good discussion on classical addiction and the definition of classical addiction. And I think food doesn't really currently fit into that pattern of classical addiction, but maybe one of the exceptions there is binge eating and another kind of eating disorders that could be maybe more like other addictions, that things that we're used to calling addictions. And then at the very end of the day, there was a very good comment about food and food components, and if they are truly addicting, what are we going to do about it? What's the intervention, and what can be done if we find out that this is true? So I think some of these things could really help frame the discussion today. We have a very good point-counterpoint session this morning, and then Edmund Rolls is going to come in after and kind of try to sum this all up, the challenging job of summing this all up. And we've built a lot of discussion time into this morning, so please stick around and help us get these issues out on the table. So it's my pleasure to start us off by introducing Joe Leavitt. Joe is a partner at Hogan's & Lovell in Washington, D.C. He was at the FDA for 25 years, of which 6 years he was the director of the Center for Food Safety and Applied Nutrition. He counsels for numerous food companies and trade associations in issues such as food safety, labeling, and compliance, and how to work effectively with the FDA. He's a recognized expert in the Food Safety Modernization Act, including all phases of development and implementation. So Joe, I'm very honored to have you kick off this session.